Everyone, today we are going to speak about analgesics. Analgesics are those drugs which can reduce your pain or reduce the inflammation in your body as a loss of consciousness, or sometimes there is a without of disturbing the nervous system, because your nervous system should not be disturbed. Once you are taking an analgesic, that means you are trying to control the inflammation in your body, you are trying to control your pain, as well as you are trying to control the point of pain or the place where you are having actually the real kind of inflammation. Inflammation may be due to injury, may be due to kind of blood clotting, or it may be kind of a little bit of stressful situations. For example, if you are having a headache, so headache is a kind of stressful situation in which you are not able to realize what is the exact cause. You are not having any kind of internal injury nor external injury, but it's a kind of stress and strain towards your nerves or the nervous system, or there might be some kind of minimal clotting in your blood near the cerebral part. Apart from this, there are narcotic analgesics. Some of the narcotic analgesics are like morphine, codeine and heroin. These are addictive and adverse effects. Narcotic analgesics, if a person is taking, for example, nowadays we have heard, since many years actually we are hearing that many of the students or people are usually taking drugs. If we say, people usually say drugs means somewhat like kind of a different thing. It's not different. Those are also medicines. Those are prohibited medicines. Those medicines are not easily obtained in the market. None of the medical store provides you easily without any kind of prescription from a prescribed doctor or a medical physician. But it has been sold illegally in the market, so that many persons purchase it and you get a feeling of drowsiness, you get a feeling of relaxation, because your nervous system gets a little bit of remorse. So in this situation, that is dysphoria, fatigue, mental confusion, etc. can arise. In codeine is less potent analgesic than morphine. Morphine is more harmful than codeine. But in both the cases, both codeine and morphine, these are analgesics. These are narcotic analgesics. They produce a narcotic effect. They cause a kind of, I would not say neurological disorder, but neurologically a man or a woman, when takes this particular kind of medicine, it's not under their own potential control. Apart from that, there is non-narcotic analgesics. These drugs, when consumed, do not produce any significant depression in the central nervous system. Mainly any kind of medicine, whether it's narcotic or I would say non-narcotic, both are in a state of central nervous system. They affect the central nervous system, not the peripheral nervous system, but the central nervous system. Central nervous system controls 85 to 90% of your body activity, including your internal organs, including your external aspects, including your senses, what you can say that. So there should be a tissue causing a redness in the skin, edema. One of the thing is edema, then granulation of tissue, etc. The anti-inflammatory action of analgesic reduces the cause of inflammation. They reduce the cause of inflammation, but they don't treat you. Reducing pain is not the next name of a treatment. Treatment is a different thing. Reducing pain is just a temporary effect. Right? You need to visit to a doctor, you need to see a doctor. The doctor will provide you the exact cause. Concerning to the organic chemistry, if we concern with my subject of organic chemistry, which you are like nowadays being seen, you know that there are various painkillers in the market, like Saridon, Combiflame, combinational drugs, then specific drug, then targeted medicines, then non-targeted medicines, then broad spectrum medicine, then narrow spectrum medicines. But still, majority of the doctors around the globe still prefer aspirin. Aspirin is the oldest painkiller. I'm not sure about the date when it was launched, because we, being an organic chemistry persons, don't deal with the dates of the launch of the medicines. We only deal with the chemical actions of that particular thing. But aspirin is one of the commonly used drugs as an analgesic, anti-inflammatory and antipyretic. That means it also reduces a certain kind of fever. So it's a kind of combinational drug. Right now, aspirin is easily in the market, is easily available, but still a medical prescription is necessary, because every age, every weight has a different kind of dose which should be provided. There should not be one kind of dose that can be provided for everyone. ठीक है ना? So next, it is obtained by the acylation of salicylic acid. When salicylic acid is used, that is a benzene ring with an OH and COH. That means we are using two functional groups. The first functional group is OH, that is alcohol, and COOH is the second functional group, which is known as a carboxylic acid. When it is processed under a catalyst known as acetic anhydride. Acetic anhydride, if I say, it will be considered as an anhydride status. That means a less amount of water is being taken, or it is less aqueous. So it provides a formula of aspirin in which there is OCOCH3 attached with benzene and another COH is retained. That means there is only a specific change of OH, that is alcohol gets changed and combined with a methyl group and an oxomethyl group. So this provides an aspirin, which is a technical name is orthoacetyl salicylic acid. So if I say those are the OCOCH3 and COOH which are actually adjacent. They are not 90° on the positions, but they are adjacent towards the benzene ring. If this is a benzene ring, this is an adjacent position. So this is an adjacent position of 2, second number of carbon and third number of carbon. These are the carbons in which it is associated. So other non-narcotic drugs may be more in the market, but they can be termed into a common use. Some of the common non-narcotic drugs which are available in the market, which are prescribed by the doctors and very easily you can be available in the medical store, but still I prefer and I would say that knowledge is good, but before taking any medicine you should consult to a doctor. So some of the medicines which are non-narcotic category are paracetamol, ibuprofen and methyl salicylate. So these are some of the non-narcotic drugs which are easily available in the market, which are prescribed by the doctors via prescription, and that helps you to treat yourself in terms of inflammation, in terms of feverish condition, in terms of body pain or body ache, in sometimes targeted medicines for headache or stomach pain or certain kind of infections. So in short, if I summarize everything, non-narcotic drugs or it is narcotic drugs. Narcotic drugs is strictly prohibited, but non-narcotic drugs should not be taken by your own. It should be taken or consulted by a doctor, and what kind of prescription or what kind of dose the doctor provides you, that should be followed. So for today, we have just discussed for narcotics and non-narcotics. I was having less time today because it was due to my busy schedule. Previously, I was trying to telecast it on live, but right now I have recorded for you. So you can go through it. If you need any kind of questions regarding this, you can just ping me. Thank you very much. Bye-bye.